हेलो एवरीवन, आई एम डॉक्टर मधु गोयल, सीनियर ऑब्स्टेट्रिशियन एंड गायनेकोलॉजिस्ट। और आज हम एक बहुत ही इंपॉर्टेंट टॉपिक पे बात करने वाले हैं, वो है पोस्ट अबॉर्शन केयर। अबॉर्शन हो जाता है लेकिन पेशेंट के बहुत क्वेरीज होते हैं, दे आर वेरी कंफ्यूज्ड कि हम अब अपना ध्यान कैसे रखें। सो लेट मी गिव यू सम इम्पॉर्टेंट टिप्स रिगार्डिंग दिस वेरी इंपॉर्टेंट पीरियड। It is usual to expect some kind of bleeding after an abortion, both after a medical as well as a surgical abortion. And at this time, it is important to remember that you should not use tampons. Use your regular pads. No vaginal products have to be inserted at this particular time. While it is normal to bleed for some time, if you have heavy periods, that means if you're using more than 2 pads in 2 hours, then you should contact your obstetrician and gynecologist immediately. It is normal to have some kind of cramping or pain following an abortion. This is probably where your uterus is getting smaller back to your pre-pregnancy size. But if you have severe cramping, that is another warning sign, and you should discuss it with your doctor immediately. The third thing is rest. A lot of patients ask, what is the kind of rest I am expected to take? While we do not insist on complete bed rest, we do tell you that you need to have relative rest for some time. It is a good idea to take a break for maybe about a day or two and then join back work. But it is important to remember that any kind of strenuous physical activity should be avoided for a period of 2 weeks following an abortion. The other thing that normally people are confused about is the medicines which are given post-procedure. So we normally give you antibiotics and painkillers on the first visit, and once you have a follow-up visit, we give you a lot of iron, vitamins and antioxidants, and this is mainly to supplement all the blood that has been lost during the procedure. And it is important that you go up for your follow-up visit with your doctor and take the required supplements. If you are an Rh negative mother and you've had an abortion and your partner is Rh positive, or the partner's blood group is not known, we would like to give you anti-D because this prevents complications in the subsequent pregnancy. The other important thing that you need to remember is that you should refrain from having sex for a period of 2 weeks. And while it is okay to be intimate with your partner after 2 weeks, it is also important to use the required contraception. Because remember, even though you've not had your next periods, you still ovulate and you can get pregnant. And patients who have not followed this have sometimes landed in soup because they become pregnant immediately after an abortion. So when can you plan your next pregnancy? It is important that you give some time, take a break for 3 to 6 months before you plan your pregnancy, and you should have a pre-pregnancy visit before actually getting pregnant. Now, when do you expect your next periods? So sometimes periods can be delayed following an abortion, and your next cycle may come back after 4 to 6 weeks. It will be like any normal regular cycle and will be followed by normal periods thereafter. The last but a very important thing is that you need to deal with this mentally and emotionally. Even though the abortion may have been your choice, there may still be periods that you may feel sad, depressed. You may have an initial feeling of relief, and then later on, you may require some support. So if you're feeling very low, very depressed, crying spells are there, it is important that you reach out to your doctor or to your psychologist. I hope this video helps you through this turbulent phase of your life. And for more information on any such topics, please follow our channel.